Xin chào các bạn. Kênh này được lập ra với mục đích là ghi lại quá trình học tiếng Anh chuyên ngành của mình. Thế nên là trong quá trình học cũng sẽ có những chỗ mà mình không biết hoặc có những chỗ mình sai. Mình sẽ để trống và các bạn có thể hoàn toàn đưa ra góp ý hoặc là đưa ra đáp án đúng giúp mình. Thích thì có thể xem. Hôm nay mình có một cái cây lâm sàng của gây mê hồi sức về sử dụng thuốc co mạch trên chuyên khoa gây mê. Yeah, now I will start. Case synopsis. A 73-year-old woman with a history of chronic arterial hypertension and coronary heart disease undergoes surgery for an infected hip prosthesis. Etomidate, fentanyl, and rocuronium are used to induce anesthesia. After induction, the patient's arterial blood pressure (BP) suddenly dropped to 60/40/30 millimeter of mercury. Systolic means diastolic. Infusion of 1 liter normal saline and 5 mg intravenous bolus injections of ephedrine have no significant effect on BP. Continuous infusion of norepinephrine restore BP to a more normal range, 105/74/58 millimeter of mercury. However, simultaneously, the patient developed tachycardia with ventricular ectopic beat after norepinephrine is increased to 0.35 microgram per kilogram per minute. Atrial fibrillation with a rapid ventricular response developed without a certain reduction in arterial blood pressure. Problem analysis. Definition. The first priority of perioperative cardiovascular care is to maintain adequate perfusion of vital organs. In addition to sufficient cardiac output, mean arterial BP must be maintained to secure organ perfusion pressure. According to arterial hypotension is either a mean arterial pressure MAP less than 60 millimeter of mercury or drop in a MAP of more than 30% from preoperative values. Below a MAP of about 60 millimeter of mercury, vascular autoregulation declines in brain, kidney, and part of the gastrointestinal tract. For the heart, autoregulation is lost below a diastolic BP of 50 to 55 millimeter of mercury, presuming a normal left ventricular and diastolic perfusion. With loss of autoregulation, vital organ perfusion becomes compromised. Fluid, inotropes, and vasopressors are used to treat hypotension in perioperative and critical care settings. After restoration of normal volemia and adequate cardiac output with intravenous fluid, inotropes, ongoing hypotension may require the use of vasopressors. Commonly used vasopressors in the perioperative are dopamine, norepinephrine, epinephrine, phenylephrine, and vasopressin. All these drugs exert their effect by stimulating alpha adrenergic and beta adrenergic receptors. The receptors are found not only in vascular and cardiac smooth muscle, but also in liver, fat, and leukocytes, bronchiolar, smooth muscle, fat, and muscle. Systemic inflammation or sepsis lead to high cytokine concentration with overproduction of nitric acid. In turn, both membranous and cytosolic adrenergic receptor complexes are quantitatively and quantitatively downregulated. These pathophysiologic adaptive mechanisms lead to reduced effect of endogenous or exogenous catecholamines, often necessitating the infusion of even higher catecholamine dose to ensure adequate vital organ perfusion. However, such high-dose catecholamine infusion may affect risk-benefit ratio of adrenergic vasopressor therapy beyond clinical adequate range. Tiếp theo đấy thì mình sẽ có một video giải thích những thuật ngữ hoặc những cụm thuật ngữ chuyên ngành mà mình đã học được trong cái đoạn ngắn này nhé. Nếu các bạn muốn xem thì các bạn có thể follow video tiếp theo của mình.